welcome to Make It Make Sense, the podcast where healthcare meets hustle.
That's right. I'm Spring Lane, a nurse practitioner and owner of Exceptional Wellness. I'm your go-to for keeping it real in the trenches of healthcare.
And I'm Kim Lynch, CEO of Metis Health Technologies, and your guide to navigating the big picture of health policy, business strategy, and making it all work for you.
Together, we're longtime operators, business partners, and friends who've seen pretty much all of it. From Capitol Hill to the clinic, we know healthcare can feel like a hot mess.
But it doesn't have to. Each week, we're breaking down the chaos of healthcare now and sharing how you can not just survive, but thrive.
We're making bold moves, new business models, and tips to reclaim your time, money, and sanity.
So whether you're running a clinic, building a business, or just trying to make it all make sense,
check us out at beesandunicorns.com, where you can find the episode transcript, and don't forget to hit subscribe.
Let's dive in and make it make sense.
This podcast is all about sharing ideas and opinions for building better healthcare. It's not for advice. For your healthcare, business, or any other important decisions, consult a qualified expert. And just so we're clear, views expressed here are personal and not official positions of any organization.
Good morning, Spring.
Kim, nice to see you always.
Likewise, it is a gorgeous morning here in Cape Elizabeth, Maine. How about you? Where are you in space and time today?
Space and time, I mean, I don't even know.
That's how I ask the question these days. Where are you in space and time?
But in Lake Charles, Louisiana, we had such a beautiful sunrise this morning, and I'm gonna jump into my tiny joy because I just love the sunrise sunset is one of my favorites, right? And every day it's just one of those things that can always get me just oh. And I don't ever see an ugly sunrise or an ugly sunset. I know some people feel that way. I don't ever. But so this morning, whenever I was driving over the bridge, which I live just over the bridge in Westlake, I get to see the most beautiful view over the lake of the sunrise. And I come over, and my friend is oftentimes looking at the sunrise. We'll go watch it together sometimes. So I drove by the golf course to see if she was there, and she was. And I get out, and I was about to go and meet her, but then I see it's her and her mom. So her mom is actually one of my patients, and it's so fun to see, because this whole family has learned so many things about health, and they're watching the sunrise together, and to just see the things that have changed in their lives that are more health producing. And I know that's super nerdy of me as a wellness.
That's adorable.
I'm watching the sunrise. They're getting their morning sun together. Community plus the sunrise plus the connectedness. That was
oh my goodness,
maybe a big joy.
That's a huge joy. I mean, the cinematic picture of you going across the bridge, seeing your friend, and realizing she's there with her mom, that is precious. So my tiny joy is similarly sunrise related. So here in Maine, I have been getting up in the morning and doing yoga, and in the last week, doing a jump into the Atlantic Ocean in the morning. And this morning, honestly, I was not feeling it. My allergies were bugging me, and did yoga, and I pushed through, and it was spectacular this morning. The tide was up, the water was crystal clear, and as I'm floating in the still very cold Atlantic Ocean, for a moment, not long, all I could think was I would have missed this. And the fact that I do anything like this is directly related to being friends with you, Spring, and our shared friend Anna. The whole cold plunge idea is not something that I did a year and a half ago, but man, oh man, to wake up with the sunrise, and I'm with you, I've never seen an ugly sunrise or an ugly sunset, is such a joyful thing for me. And for me to get to access the water first thing in the morning is perhaps the most magical thing. I feel I'm back at summer camp me, camp counselor, 16-year-old me, running through the woods in the morning and jumping into the water. So that's my tiny joy today. But I love that we're both sunrise.
Yes. We can do a sunrise together.
Oh, yes. Well, obviously we'll be doing that soon.
Yes. I'm as many times as we have been together.
That's crazy.
So whenever I would go on trips when I was in DC,
countless meals with
Yeah.
Spring. Let's be clear. Like, we have eaten together. We have done so many things.
yeah,
And many miles, but no,
that's on the
not a
list.
sunrise.
The next
On the
time we hang
list.
out, we're sunrising together. Yeah. And we
I'm
should do
into
it
it.
near water because, oh my gosh, why not? I'm with you. Like water bug, let's go.
Not Washington, D.C. water. I have fallen into the Potomac. I don't recommend it. We'll do it somewhere like a little further towards the shore. Yeah, a little more
Yeah.
oceany.
I mean, or anywhere that's not disgusting.
Yes. Yes. Yes, please. My goodness. Well, I'm really excited to get into our topic today because it actually spins right off of something you said, off of your tiny joy of sunshine on your face. To me is a perfect encapsulation to me as a human of my responsibility, my agency around my health. And so our topic today is quality. What a behemoth. We're definitely starting this conversation. We're not going to close it out today by any stretch. But that getting sunlight on your face, that is one of the behaviors I'm teaching my children. We even have a mnemonic in our house to remind them you have to get outside to get sunshine on your face, because those tiny acts of like agency, of personal responsibility, like those are the little kernels that I want them building as kiddos now. And certainly, as a patient, as a human, I think of agency and my choices as building blocks towards my own outcomes. And I'm so curious how others think of it, and can't wait to hear, Spring, your thoughts as we crack open this topic today.
Yeah. Yeah. Quality is gigantic. And I think, it's defined so many different ways. As an informatics nurse at the hospital, when I thought of quality, I thought of like certain things we were measuring to tell the insurance company about so that they would pay us the money that we needed to take care of the patients, right? That was my introduction to quality.
Sure.
And so as an informatics nurse, I was like trying to pull the data from all the notes so that first our quality nurse could get the information that she needed to stay on top of what needed to be ordered or discontinued, whatever. And, that was my first exposure to quality as a term in healthcare. And then, over the years of practice and my own kind of like, why do we do what we do? Because I'm just curious by nature, which I'm so thankful for. And it leads me down these rabbit holes of like, okay, well, let's go back to my initial experience with CAUTI, like trying to get central line infections down and urinary tract infections down in the hospital, right? Like that was my first exposure, right? And so it's like, okay, so why does the insurance company care about these infections, right? And I'm like, okay, well, in my head, they care about it because it's super freaking expensive if we get an infection. Also, I care about it as a nurse because I don't want my patients getting an infection that they didn't have to have, right? I understand that there's risk with everything and like nothing's perfect, whatever. So anyways, that's like the why behind it, right? But then I start getting deeper, right? To your point about like the patient, right? So a lot of times as a nurse, I would put in a catheter, right? And we'd secure said catheter to the thigh with some really fancy tape that also had Velcro. Like I was meticulous about it, okay? Because I want you to not have it pulling on your urethra and causing inflammation, which will cause more problems because your body's going to send white blood cells there because it needs to heal the inflammation. And now we've got mucus and now we've got more bacteria. Like I understand how all of that works, right? So I'm trying to save you some trouble, sister or brother, whoever, So we were putting said tape on. And then, you have patients who like undo the tape or they don't like this, they don't like that, they want it a different way. And it's like, okay, fine, call me and I will help you adjust it so that we don't get it infected, right?
Right.
And they wouldn't listen, they do whatever they wanted to do. They didn't want to call you, whatever. And so it's like, okay, hello, we're having a conversation here. I need you to help me help you, okay?
And that's it right there. That's it. The help me help you piece of it. To me, quality is all about outcomes, and the outcome is defined by me as the patient, as the human. Of does it feel good? Does it not feel good? Do I feel better? Do I not feel better? And so, I love this topic. There is a whole lot of measurement in here. There's a whole lot of alignment of interests and a lot of misalignment. occasionally with quality programs. But what I love is bringing it back to, how does the person feel? Does that patient feel better? And if a solution doesn't work for them, like you're saying, the patient's got to be in a position, the other human's got to be in a position to voice that, to say, hey, this tape isn't working for me, or I'm not feeling right about this. But that using your voice, to me, is that first act of agency, that if we're going to get to any outcome that is positive, I think it begins with listening to yourself and using your voice in those moments, even if it's first to yourself, to say, how does this feel to me, before you then figure out how to say it to your clinician care provider.
Yeah. I think that is an area that, we've shared before. Kind of one whys for what I do, is I have recently, and I just spoke with the family yesterday, so it's fresh on my heart, about losing a friend recently, after a 10-year battle with cancer. And, one of the things that hurts my heart about our system for people like my friend is that not everybody ready to speak up. Not everybody can say, hey, I'm not comfortable with this. This doesn't feel good. Not everybody trusts themselves enough to even honor their feelings, right? Because they sometimes say, well, the clinician said I need this, so I must need it, right? So I should just be quiet and take it. And what I think you're getting at, and what I hope to clearly convey, if possible, is to all those folks out there, like if you're listening to this and you have someone in your family who they don't speak up, right? Who they're the ones that they're always coming to you and telling you what's going on, but like they're not going to say it to that person because they just think, they wear that hat. They must know better than me. Please, please, please share this with them. And please, please, please share love with them, that like the reason that sometimes things go the way they go is because the clinician missing your part. They don't hear your story. They don't know what's going on. You might have a very willing to understand clinician. And I think we don't know as patients how much their decision for what we need is based off of what we said. So if we aren't saying what we need, then they aren't making decisions on our behalf. So we can just be quiet and think that they are making decisions. They are assuming a lot. So we have to help them know where we really are. So kind of to your point about like the sun, right? So when I first start talking to patients, sometimes, it's like, hey, yeah, morning sun is going to help you get better sleep at night. And that makes no sense to them. And I totally get it. But literature shows that, right? And so they're like, man, but I can't get up that early, right? And all these things. And so it's like we talk through all of that. But if I were to be talking to someone who didn't want to say that, right? And let's just say that they were like, well, they said I need morning sun. Okay, fine. So some people like just open their window and not go outside. Right. And that's not the same, right? And so they'll like just try to figure it out. And it's like you aren't actually getting the quality that you desire because you aren't having the conversation. You have to really lean in, ask questions, say what you like, what you don't like. Like there's so many paths to that place that you want to be. So it's like,
right.
The more that you can actually have that conversation, the closer you are going to get to that desired outcome.
I mean, and everything about that makes sense to me from what I've observed in my own experience, because yes, the evidence is there, but also in my own life, as I have gotten sun on my face at the beginning of the day and encouraged my children to do the same thing. Guess what? They're less grumpy. My goodness, I'm less grouchy. But that dialogue, like you're saying, of I'm trying this and it didn't work, or I'm trying this and it's, through a window, well, maybe you're not getting the benefit. Being able to have that dialogue, I think that is the first step to any quality outcome. Because if you're holding back, if you're not listening to yourself, if you're not sharing that dialogue, how can we possibly get to the ideal, to the best outcomes is really where I start. I mean, I come at this, I think from a different position from a lot of folks. I would be curious of other folks who were raised by clinicians. I'm the daughter of a doctor. I never had any problem with telling my clinicians what was going on with me because I was raised by my dad. I was totally comfortable with his colleagues. And I remember seeing, as I started my healthcare career, exactly what you're talking about. People holding back, people deferring to the degree or they know better. And my goodness, those are not thriving practices. Those are, quite frankly, not the happy clinicians either. It's the clinicians that have that dialogue with their patients that I see thriving and feeling proud of themselves as saying, yep, this is really hard. I'm staying on top of my training and I'm constantly learning from my patients, from new literature, from my colleagues as a patient, again, and from a quality standpoint. Those are the clinicians I want to see, the ones that are taking in their training and new information and wanting to teach me and help me be empowered, which is part of what I love about, everything you do, Spring, because that's the root of it. It's not me outsourcing my outcomes to someone else who's going to make sure I'm healthy. They're my outcomes. It's my life. And the clinicians and my friends and family and everyone around me are part of making that happen. But it begins with me.
Yeah. Yeah. I love that. I know when we were talking about this yesterday, we said, agency quality starts with agency, right? So, and I do believe that, like, because the moment that I say I'm in it, right? Like, I am in this for this outcome, and I'm going to stay committed to being curious and open till we get the outcome, right? And so, as a patient, hey, I'm not really sure why we're taking this step. Can you help me understand? Right? I'm not really sure how to take this step. Can you equip me? Right? I'm not really sure if I can do this. And that's where the
I tried
empowering
it.
comes in.
Yeah, I
It's
tried
like,
this and it didn't work. I need to try something else. Being able to say, I tried it, it didn't work. Or, I mean, I say this all the time to my clinicians. I'm not going to do that.
yeah,
I say the same thing, quite frankly, to my hairstylist. We have very similar relationships. My hairstylist and my doctor. They're like, I'm not going to do that. I'm not going to blow dry my hair. I'm not going to
yeah.
do that. Right. So, and I love being able to have that I love that you're laughing at this. Like this
It's the
to
same kind
me
of
is,
conversations I have with my hairdresser. He's like, I need you to dye that gray right there, sister.
I will
Like,
not be doing that.
and I'm like, no, I earned all of that. Can you
Precisely.
believe all earned?
But finding that what works begins with that dialogue. Absolutely.
Yeah. Yeah. And it's like, so it's like first step, right? I'm patient. I have to have my own agency. I have to really honor myself and what I want, what my outcomes I desire are, right? If I do not want to be on medication, and I'm so proud of some of my patients because they will straight up tell because they don't all have me as their PCP, right? Some of them I'm kind of like a part of their system, which I super love. That's really what I see exceptional wellness being, an extension of the system, because right now we don't have anybody who's focusing on preventing and like working in that lane of like, are we doing all the things we can to prevent disease? Like I'm like, our job doesn't stop at you don't have disease today. Like for
we
me,
are
our
upstream
job
primary
is
prevention all day long.
our job is where are you going? Is that where you want to go? Like, do you want to have a heart attack in the next 10 years? Because I feel like no, but that's my assumption. Let me make sure, let's have this conversation. But like, just so you're very, very aware of the track you're on, right? Like, some people, they're like, actually, if the good Lord will take me today, I mean, they'll tell me stuff like this. And I'm like, okay, like,
Okay.
I'm not here to change your trajectory if you don't want to. Like, I will, I'm just part of the team. I love you. I will support you every way I can, right? And so it starts with that agency of self, being willing to get in there. And then when you do share that, right, you need to have a clinician who's going to be receptive. So they're also operating in their agency, right? They can have these conversations where because I tell patients sometimes, right? Like a patient might want a certain plan, a certain way. Hormone therapy comes to mind because I have very strict boundaries on what I will and won't do as far as hormone therapy goes. And it's because to me, it's what's safe. It's what literature supports, right? I'm probably more restrictive than some of my peers, and that's okay. Like, I'm not saying they're doing it wrong or I'm doing it right or anything like that. I am honoring my own agency, right? This is my clinic. I get to practice how I choose. And if my patient is like, hey, I want this path, and I'm like, I only do it this way, I love and respect you. Here's some other providers who will do it that other way or might do it that other way, right? So be free. I love you, whatever, But you need to have a clinician who's going to meet you where you are, right? And be willing to have that dialogue. And then the other thing that we're building as part of our prevention provider network is we need a network that supports both of those people having agency. So, like you can have that dialogue of, okay, like systematically, we got to think this through, guys, like, because we have this much money that we need to spend in certain ways, right? And so, like, figuring that out in all of those ways, I agree. Agency is what leads the way for quality to really be what it should be.
I think it's so interesting too. I mean, these large data sets that you were mentioning in the beginning. I love large data sets. Longitudinal data and public health data is where I begin. And at the same time, every single one of those numbers is someone's loved one. And to me, right, like I'm very comfortable looking out for myself and my loved ones and thinking about how we can design a system where every person's loved one is in a position where their voice can be heard, where they know that their agency matters, whether they're a clinician in that scenario or a patient in the scenario. Because a recent example, there was a cyber attack on a hospital in the US, and I was texting with several of the doctors that were part of that system or had left that system, and heard anecdotally about doctors striking to close the emergency room because it wasn't safe to see patients. And that cyber attack was limiting ordering. They couldn't get into their electronic medical record. I mean, rounding was a disaster. It was all of these anecdotes kind of kept under the waterline as I was hearing about it. But it was the ultimate act of the doctors exercising their agency, saying this is unsafe for patient care, that stopped the hospital admitting patients. And as a patient, I mean, it sent shivers through me because I don't know if I walk in to an ER if it's safe or not. I have to rely on the clinicians. Right. And that is the trust relationship that I, as a patient, hold with every clinician, and every patient should be able to hold with their clinician, whether they are an independent provider like USpring or their provider in a hospital, a health system. So to me, that point of agency on the clinician side is equally important to the patient in driving any outcome, like you're saying. Whatever the trajectory is, there's equal responsibility and driving towards that outcome, I think.
Yeah, I agree totally. And I know we're coming up on the hour, and yesterday when we were talking kind of about this topic, I shared with you that a friend of mine was reading this book and shared with me some journal prompts. And it's about, just one more, right? One more rep, one more, trial, one more. And so I think about that because this week has been really heavy for me as a clinician. I've had quite a few patients just crying, sobbing, really, in my office. And that is so hard. I sometimes, I think, after 20 years in practice, in like talking and having these hard conversations with people, there's a part of you, I think, that kind of disassociates and you don't even notice that you're doing that because you just get through the moment. But I noticed I've been so aware of my, energy and my mood and all of that. And so I picked up on, I'm like, this is not me. Like I'm in a funk, right? And I don't like that. And I feel heavy. And so I kind of got some alone time. I did some sauna and started thinking, and I'm like, I am carrying this heaviness from my patients. And I have a good friend, a colleague who's been in healthcare for about as long, maybe a few years longer. And he said a long time ago, he's like, so you got to remember that like your responsibility only goes so far, right? And if I'm not careful, which sometimes I'm not, I can get this like savior complex and think I'm like going to save everybody and fix everything. And it's all my responsibility because it's hard to watch someone suffer. So, you can lean on one side of like, none of it's my responsibility and I could give two, and it's like, good luck, I don't care, right? Or on the other end, where I can get to where I take on too much of the responsibility and think like, I've got to find a way to get in their house and get rid of all the toxic exposure in their house.
Right.
And like, that's too much. I know that. Saying it out loud, I know that. But there's a part of me whenever I'm talking to them that it's like, I just want it all to go away for them, right? Like, I want to fix it all. And, really just acknowledging that, yes, I need to be on my game. I need to be educated, equipped, and empowered to help people be exceptionally well as much as they need to be educated, equipped, and empowered to be exceptionally well, right? So I know that. I believe that 100%, like not letting go of that. And I can educate, equip, and empower and be like, that really is enough, because if you're going to continue giving to me high quality, exceptional care, you're going to have to get into the yuck, right? You're going to have these conversations. You're going to be learning new things and trying new things and, exploring things with your patients. And there's a part where it's like, that really is enough. And I don't know. I just think that is kind of challenging. So what's one thing that I can do to listen to my patients' needs and desires? What is one thing that I can do to support my patients' needs and desires? What is one thing I can research to support my patients' needs? When I'm thinking about that, it's like, I like that string of questioning, because it's not me trying to do everything, but like, if I was going to do one more thing, and a lot of times that one thing takes a couple seconds. It really just takes like taking a breath and really sitting with them in that moment, or really listening for what the need is, because a lot of times it's not what I think it is.
I love that pause that you're describing, that maybe that's really where we leave this conversation today, because it is vast, but that pause of, as a clinician, have I done enough? Am I kind of at where I've, my boundary that feels right for me? And as a patient, as a person, have I spoken my truth? Have I shared, what's going on with me? And just that pause to check in, I think, is really meaningful. And certainly in a care relationship, it seems like those pauses are also the time where we get to experiment and discover what does work. And that discovery, that like, oh my gosh, it did work. I found something, delicious that I can make myself. Or I did find, my God, I still hate getting up in the morning, but I found a way to like roll myself, and get sun on my face. Those are tiny joys. And once you start building them, you get really excited. And I think those tiny things are the catalyst for big outcomes, whatever they are.
This conversation just inspired me. We had a conversation months ago on one of our casts about being a community provider and thinking about how, maybe I can't do everything, but I can be a member of the community. And I just thought about a couple of different businesses that I know in the area who do mold remediation. And I'm like, I wonder if I could come up with a way to entice them to do something for these people because we have so many people in businesses and homes that are still riddled with mold.
Yeah.
And there's some really shady stuff going on in some of these places because they're just trying to but these people are having really devastating health impacts,
massive
right?
health.
And so
gosh.
I'm like, maybe I could have one of these people be a good guy, that's going to be good. So anyways, I wrote a note. I'm going to go do that today.
I love it. Oh my gosh.
Action.
What an amazing.
Do something.
Take action, do something. What a perfect note to end on today. Thank you, Spring. This was awesome.
Love you.
Mwah.
Thank you.
Love you too. Bye. Everyone.